What's up, YouTube? It's Logan. So this is going to be my 7 months on T and 3 months post-op video. I'm about 2 weeks late on this video. It's been a little crazy this month, so I apologize for that. So it's maybe not quite 7 months, little 7.5 months. So I'm just going to jump right in. I'm still taking the 75 milligrams weekly. I have not changed my dose since last video. I mentioned that I went up to 100 weekly and that it was too high for me. So I'm still doing 75 weekly. I think actually the other couple weeks ago I accidentally gave myself more than I should have. I was kind of late for work and I was rushing. And I felt like shit for 2 days after that. So I know that 75 milligrams is exactly where I need to be. So as far as changes go, my voice has dropped pretty significantly this month. I say that in every video, I feel like. I'm really not sure when the voice dropping stops. I've consulted a couple people, but everybody says that it kind of depends on the person. And I had asked a couple people what they thought about my voice, and a lot of them said, "Oh, you sound like a pubescent teenager." So I'm hoping I'm getting more into the adult male range at this point. So we'll see. With that being said, I have been passing on the phone and in a drive-through, which was an issue in my last. I don't know if I mentioned my last video, but within the last 2 weeks, I've started to pass on the phone, which is new, because I kind of inflect my voice in a way that a lot of people read me as female over the phone. So I guess now it's deep enough to where people actually read me as male, which is cool. That happened for the first time a few weeks ago, and I was like, what? And then a couple weeks, maybe a week ago, I was ordering at Sonic, and he was like, "Yes, sir, is that all I can get you?" And I was like, yes. I gave him a big tip. Anyway, aside from that, hair, I mean, it's just the same old hair, voice, same thing. I do have more hair on my stomach. I'm kind of short. I don't know if you can see. That is coming in nicely, and my legs is creeping up. It's pretty much meets my pubic hair meets my thigh hair now, which I didn't really have thigh hair before. So that's, I don't know if it's ever gonna stop. I've also noticed that I have more hair on my forearms than I did, or at least it's darker. As far as facial hair goes, I have very little in the way of facial hair, mostly just acne, but it's gonna come in time. I say a lot, sorry about that. Let's see. So the biggest thing that's happened this month has been passing on the phone and through the drive-thru. My voice has dropped significantly. I'm actually passing in person about half the time, a little more than half the time, which was more than last month, which was less than half the time. So more people were breeding me as male. And then hair. That's about it. I feel pretty consistent as far as my moods go. I don't really feel a whole lot of moodiness anymore. In fact, I actually feel a lot more mental clarity than I did before testosterone. I've also been doing push-ups now that and so I actually have quite a bit of traps and biceps coming in, which is nice. This shirt actually didn't really fit me very well before, and now it makes me look more filled out, which is cool. With that being said, I have put on muscle and I've lost fat. I mentioned in my testosterone update, the written one on my Tumblr, that I've lost about probably close to 15 pounds since May. I think that part of it had to do with getting on Synthroid, because I have hypothyroidism. I've been on the Synthroid, or the thyroid hormone, for about, I guess, 3 or 4 months. And so last time I had my levels checked, they were normal. So I'm guessing that kind of aided in my weight loss. as well as I'm more active now that I'm kind of past the healing phase of surgery, and I just don't eat that much, which is weird because I thought that, being on testosterone, I would be ravenous all the time, but it's actually been quite the opposite. Alright, so that's enough about testosterone. I've wasted 5 minutes on that. So I'll just get right to my chest. So like I said, this is a little more than 3 months post-op because I'm a procrastinator and terrible at making videos. So this is what I'm looking like. This is the left side. This is the right side. I have full range of motion, like before. So the one thing that I noticed this month is that my left nipple is significantly bigger than the right nipple. Or I don't know that it's necessarily bigger, but it protrudes out significantly more than my right. I don't think that this is necessarily the fault of Dr. Garramone. I think that it's just the way that my skin healed from the grafts. I think that the skin around my areola did not take to the nipple on this side as much as it did on this side, or at least this one protrudes out much more than this one, which gives the appearance that it's bigger. But I really think that it's just a matter of how much it comes out from the chest. I don't really know if Garramone's desired result of the nipple was this or this, but as far as a personal preference goes, I like my nipple on this side because it's not quite as evident. With that being said, I am going to look into having my nipple on my left side resized. I think that they just make an incision and take out a chunk of the bottom, and then they put the two flaps back together and sew it back. I think that it can be done outpatient in the clinic under local anesthesia. It doesn't require anything significant. I'm probably not going to do that right now because I don't really have the money to spare, but it's something that I have in the back of my mind to do in the future. In fact, a good friend of mine is eventually going to be going to Garramone to have his top surgery. I don't know if that's probably sometime in the next year or so. So maybe at that time I'll just kind of reach out to him and say, hey, I'm going to be in the area. If I could just have you do something with my nipple, that'd be good. But I don't know if he considers that a revision or what. But yeah, so either way, I don't think it's going to be terribly expensive if I have it done somewhere else. And I think that pretty much any plastic surgeon can do that procedure. So another thing that happened this month, I was feeling fine, no pain whatsoever, and then all of a sudden I started having these shooting pains, shooting through the top of this areola and into my nipple, and this happened randomly, and it went on for a week or two, and it was tender to the touch, and it really hurt, and I was like, what is going on? And then it just went away. So I think that it was part nerve regeneration going on, and it doesn't hurt anymore. But I have tactile sensation in my nipples and in my areola and all over my chest. I can feel this. There's no numbness at all, except for a little bit right on the incision line. So maybe it was just nerve regeneration, and that's what the shooting pains were from. But it's gone now. And at the same time, I also felt when I would move, I felt some tugging right here. I don't know if you can see. I have a little bit of scar tissue right here where it's just pulled, and I also have some stretch marks here. And I haven't seen any guys that have had this issue with the stretch marks. As you can see, this nipple is smaller. I actually really this one's perfect, I think. This one is significantly more protruded out. And then I'll just kind of scan my incisions for you. They're lightening up a lot, and they're pretty much flat at this point, except for a couple places right here that's not flat, but all of this is flat. It's flush with my skin at this point. Anyway, I haven't seen any guys have issues with the stretch marks around the areola. I don't know if it's just my skin. I have really white skin, and as I healed, it just pulled or whatever, but like, I have these stretch marks that are like, I mean, I look like like pregnant women get on their stomach. I've been putting cocoa butter on it, and it seems to have lightened a little bit. And I actually just got out of the shower about 20 minutes ago, and it lightens up. The stretch marks lighten up a lot as my body temperature returns to normal. So I'm really not that worried about it. I think it's gonna resolve, but if it doesn't, whatever. I'm really happy with my chest. I mean, aside from the nipple asymmetry, I'm very happy with my chest. Lastly, I wanted to mention that I went to the, trigger warning, gynecologist a couple weeks ago. I realized that my time frame, my reference of time, always is somewhere in the two weeks, couple weeks ago. It could have been 3 months ago, and I would just say it was last week. Anyway, I went to the gyno, and she did just an exam of my chest. She was very sensitive or whatever to my being trans. But I told her that I noticed that I had like a lump, like under the skin, right around here. It's kind of hard to feel right now, but she said that it's probably just like a leftover lymph node or some sort of tissue, or scar tissue from the surgery, but that she wanted to do an ultrasound just to be sure. But I haven't had that done. The issue was that the ultrasounds were done at the hospital that I work at, which is awkward. So I didn't actually go to the appointment, so I have to reschedule that. But I really think it's fine. I think it's probably a lymph node, but just something to look out for, I guess. It doesn't hurt at all, which is a good sign. Alright, so I think that's it. I said I would keep this short, but it's like 13 minutes long, sorry. So again, like always, if you have any questions for me, you can message me on my Tumblr, links down below. Reach out to me on YouTube. I have an email address as well. If you need that, you can just message me. I will give you that. We can correspond that way if you, that's whatever. Alright, well, I'll see y'all next month. Hopefully on time this next go around.